In our world, we hear terms like mouth guard, orthotic, splint, appliance. And the nuance with all of those is that the over-the-counter guards are mass-produced. So they're a couple millimeters thick on each side, and no matter what, you get that. And a lot of times you have to brace to hold them in. They might move the teeth. They might dig into the gums. So generally speaking, for the patients we're seeing and the problems we're seeing, the over-the-counter mouth guards usually don't cut it. But to be honest, most of the patients before they see us, they've tried that stuff. They've tried the mouth guard. They've tried the over-the-counter appliance. And with a customized approach, what we're really doing is customizing the diagnosis. So we're figuring out what the patient needs before we start talking about modalities. Sometimes in medicine and dentistry, we start by treating before diagnosing. Diagnosing is paramount so we understand what's going on. So just throwing mouth guards, over-the-counter appliances and stuff like that at certain situations may not always help because it might not be what you need. And so typically in these complex problems, someone quarterbacking the situation, understanding what the diagnosis is of the utmost importance. You may need an appliance in the mouth, or you may need some modalities, but sequencing them is extremely important. And typically speaking with like the over-the-counter guards, if they're the same thickness on each side and you're asymmetrical, which most of us are, it'll cause problems on one side, it'll dig into the gums, it can move the teeth. Typically, patients don't do permanent damage with them because once it starts to hurt, they take it out. And every day in our clinic, people come in with multiple different appliances, guards, things they've tried. And a lot of times our job is to figure out why those didn't work. And a lot of that comes down to coming up with a diagnosis first and truly understanding what the problem is.